Have you ever wondered what goes on between a patient and their team of specialists? Who decides what treatment to follow? What treatment do we follow? Who diagnoses the patient? Who treats the patient? What makes them qualified to treat a person? Well, for today's video, we will be discussing just that. Today, our team will bring to you the action behind the scenes when it comes to the habilitation team. Who gives orders to who, and who's in charge of what. And as the video progresses, we will be talking about something more specific. We will talk about the role of a speech and language pathologist or SLP in the hearing impaired population. Not sure what that is? Keep watching to find out.
The habilitation team and their roles.
First and foremost, we have the patients themselves and their family. When we say family, it pertains to the individuals connected to the patient by bonds of marriage, blood, or adoption, but may include a wider social team, which is constituted from two or more individuals who live in the same space, have common sentimental bonds such as the patient's closest acquaintances and friends. So, let us define who they are. Primarily, patients are the ones who are registered or at the receiving end of a medical treatment. Definitely, they are considered to be the center of the habilitation team. On some cases or scenarios, the patient's inputs are not necessarily asked for or given that much attention, but in more recent years, patient-centered healthcare therapy facilitation has been given more importance. For us SLPs, we should take note of what the patient wants, especially for geriatric cases. Patient-centered care is the hallmark of quality healthcare. This approach encourages respectful and responsive collaboration between healthcare professionals and patients and takes into consideration patients' preferences, needs, and values. On the other hand, the patient's family has a significant role in the hospital treatment of the patients as they could provide needed psychological and emotional support to the patients undergoing treatment. On the next following slides, let us delve on their specific roles and responsibilities. To add to the previous slide, patients play an integral role in the management of their condition and are key in helping the healthcare provider make an accurate diagnosis and co-creation of an optimal treatment plan. First, patients should be made knowledgeable about their condition and treatment options. They could ask their healthcare providers for information about their condition in order to stay up to date and informed about it. Also, they should know their medications and care team. It is important to let them know what the medications they are intaking are for, its dosage, and how to take it appropriately. Also, they should know who their care team are and assist them in communicating properly their wants, needs, goals, and feelings, both physically and mentally, such as the symptoms they are experiencing and their level of adherence to the recommended treatment that they are receiving. It is highly important that they could communicate these things clearly as well as actively participate in such decisions about themselves and their care plan. As a patient, investing in an honest and open relationship with their care team would enable their therapy success. Always know that these are some of the basic rights of a patient, which include having the right to advocate for themselves and clarify any questions that they may have. Ultimately, the patient is responsible for their own health and well-being. However, a good patient-provider partnership is essential for effective health outcomes. A collaborative care process not only enhances the care plan and improves the treatment outcomes, but also can increase patient safety. Working together with healthcare professionals, the engaged patient becomes empowered to meet the challenges of their illness with knowledge, confidence, and energy. To continue, the presence of family constitutes an important source of psychological stability and source of support for better recovery, since it helps the patient to maintain contact with their household and friends. Moreover, the role of family, friends, and relatives is of vital importance for the maintenance of quality of life because they can satisfy basic needs of the patients to a large extent. Additionally, family can help decrease the stress and encourage them to respond effectively in the therapy. At the same time, family can direct the patient in order to participate in self-care activities and effectively face any complications of their illness. Consequently, the medical and nursing staff need to provide maintenance of continuous contact with parents and relatives of patients and vice versa, and provide them with the appropriate information concerning the condition of the patient and the progress of the therapeutic program. Most importantly, they provide representation of the patient and should be informed about subjects concerning them, which include collaboration about the therapeutic process as well as participation in the planning of the patient's care.
So now that we've met the patient and the family, let us now move on to our professionals. First up, the pediatrician. A pediatrician is a medical practitioner who specializes in children and young adults and their disease. More specifically, children from birth up until the age of 18. Pediatricians help manage the child's physical, behavioral, and mental health. They are trained to diagnose and treat a broad range of childhood diseases from minor health problems such as a cold to more serious illnesses. So what does a pediatrician do? Pediatricians educate parents about expected development. Parents are not always aware of how their child should be developing or what behaviors and skills are appropriate for certain ages. In this case, the pediatrician becomes an educator. The pediatrician will guide the parents on what to expect each time the child progresses to a certain stage in their development. Which brings us to another role. Pediatricians conduct developmental surveillance on the child. They monitor the child's development and decide if it is within the norm or not. This role is especially important in diagnosing diseases. Of course, pediatricians may also refer the child to other healthcare professionals so that they may conduct a more comprehensive assessment. If a child is not meeting expected developmental milestones, it is important that the child receive a more comprehensive, formalized assessment to determine the severity of the delay or deficit and whether the deficits also exist in other developmental domains. The pediatrician now refers the child to other specialists in the habilitation team, such as the speech and language pathologist. And of course, pediatricians also facilitate intervention.
Moving forward, have you had a checkup on otolaryngology before? I sure have. These professionals are known as ENT doctors or otolaryngologists. They are medical doctors who specialize in medical and surgical care involving the structures in the head and neck, clearly on the nose, ears, and the throat. Usually the reasons for visiting an otolaryngologist are hearing and balance problems, ear infections or disorders, and nasal congestion. Voice disorders are also accommodated by otolaryngologists. A fact, ENTs are known as ear doctors. In this slide, see your stated roles of otolaryngologists. They treat ear problems like infections, tumors, nerve pathway disorders that affect hearing and balance. Since they are ear doctors, they also provide treatment for other disorders in the ears, nose, and the throat, prescribe certain medications, and surgically operate. They are medical doctors who are referred if a person experiences ear problems, imbalance in hearing along with the nose, throat, and other head and neck problems. They diagnose and evaluate the ears in terms of hearing and balance, along with the nose and the throat if there are problems by means of physical examination. They are known to be hands-on for providing examinations. They collaborate with other professionals who are working on the neurological and physiological process of audition, as well as other areas, clearly speech, swallowing, cognitive linguistic aspects, and more. Listed below are just one of the few examples of medical professionals who work with ENTs.
Moving forward, we have the hearing aid specialists or distributors. According to the National Academy of Sciences, they are the ones who evaluate the extent of a client's hearing loss with various audiological tests or maybe through the help of an audiologist, after which they figure out the best fit for the client's particular level of hearing loss and provide them with the needed assistive hearing device to achieve functional and optimal hearing conditions or capabilities. Definitely, they provide a big help for the hearing impaired population, and so let us discuss what they do. In this slide, we will be delving on the roles and responsibilities of hearing aid specialists or distributors. First, they select and administer audiological tests to evaluate hearing or other related disabilities or impairments. This can also be done with the help of an audiologist. Some examples of these tests are the tympanometry, OAE or autoacoustic emissions, ABRs or auditory brainstem response, and so much more. The tests they do also cover both pediatric and geriatric patients. With this, they could see the extent and severity of the patient's hearing loss and provide them the necessary assistive hearing device they need. As such, they create or modify impressions for ear molds and hearing aid shells that are best fit for their clients. Moreover, they could also train clients to use hearing aids or augmentative communication devices, as well as maintain or repair hearing aids or other communication devices to provide the optimal care and service to their clients.
Now let's proceed to developmental pediatricians. These professionals are certified medical doctors in pediatrics who are specializing in the developmental and behavioral aspect. They are specially trained and experienced to assess and treat medical and psychosocial aspects in children's behavioral and developmental problems. In this slide, here are some roles of developmental pediatricians. They collaborate with family members and other professionals on how to manage the child's behavior and development that would affect his or her performance in various environments. They work closely with schools, preschools, and other agencies involving developmental care and education. They provide treatment for various developmental disabilities and behavioral difficulties such as learning disabilities, intellectual disabilities, ASD, ADHD, anxiety disorders, conduct disorders, visual and hearing impairments, spina bifida, cerebral palsy, and much more. Counseling is an important role for developmental pediatricians since development and behavior starts at home. They educate the families of children with these disabilities by explaining how the disability impacts to their life and what the family members can do to manage the child. They are also advocating for their patients. Developmental pediatricians are specially trained to diagnose and evaluate children with changes in behavior and development.
Next is occupational therapist. An occupational therapist is a practitioner who uses therapeutic techniques to improve, rehabilitate, or maintain a patient's physical, mental, developmental, and emotional ability to perform day-to-day tasks. The roles of an occupational therapist involves evaluating a patient's condition and needs, developing treatment plans to address the patient's needs and help them meet specific goals, assessing a patient's home and or work environment, and recommending adaptations to fit the patient's needs and improve independence, and training patients and their caregivers to use special equipment.
Moving on, we have teachers. Teachers are individuals who aid students to acquire knowledge, competence, or virtue. They are trained to inspire, motivate, encourage, and mentor students. Moreover, they help students improve their potentials and skills. Now let's discuss about the roles of a teacher. A teacher is a professional who will have to fill many roles. Aside from the ones manifested in the presentation, teachers are obligated to be the support system, mentors, and a helping hand to the students in need. They also provide knowledge and help us practice self-control and self-regulation in order to succeed later in life. Another relevant professional in the habilitation team is the audiologist. An audiologist is a licensed hearing healthcare professional who specializes in the diagnosis and treatment of hearing loss and balance disorders. They aid people with hearing disorders in preparation for a better way of communicating and connecting with the people in their vicinities. Let us now proceed to the roles and responsibilities of an audiologist. They are in charge of examining patients who have hearing, balance, or related ear problems.
They create exams to determine if a hearing loss is present and also identify the type, severity, and configuration. They assess the results of the examination and diagnose the problems. Their job is to treat individuals with impairment of peripheral or central auditory and vestibular function. Lastly, they try and prevent hearing loss from occurring in the first place.
And of course, we have the speech and language pathologists. SLPs are professionals who work across all levels and work to prevent, assess, diagnose, and treat ranges of disorders involving speech, language, social communication, cognitive communication, and swallowing in children and adults. A few of the many roles of an SLP involve evaluating, diagnosing, and treating speech, language, communication, and swallowing disorders, providing training and education to family or caregivers and other, working collaboratively with professionals from many other disciplines, working for national, state, or local associations or agencies, supervising and directing public school or clinical programs, engaging in research to enhance knowledge about human communication processes, and developing new assessment and treatment methods that may lead to more effective outcomes, and providing counseling and consultative services.
Remember when I said that we will be moving on to more specific things as the video progresses? Well, this is that part. We will now be talking about the role of a speech and language pathologist, or your chosen future profession, in the hearing impaired population. I think you'll find that this practitioner also plays a big role in this area. So keep listening to learn more.
For the scope and practice for SLPs in the hearing impairment population, speech and language pathologist specializes in preparation, experiences, and opportunities to cater communication effectiveness, communication disorders, differences, and delays that are caused by a variety of factors, of which includes hearing impairment.
In continuance of what was mentioned in the last slide, the Speech Pathology Master's Program listed and considered the following as appropriate roles of speech and language pathologists in catering for the hearing impaired population. Primarily, we should understand how hearing loss affects communication development. Of course, we may not experience this directly, but we could empathize and put ourselves in their shoes to fully see what they go through. The development of their speech, language, and communication are hugely affected by their condition, and it is our prime task to help them attain functionality in these areas. In lieu with this, when working with patients who have hearing impairment, we assess their communication skills and provide necessary treatments to improve upon it. We do this by prescribing and choosing appropriate communication techniques and strategies for the patient, which take into consideration all of the possible positive and negative prognosticating factors, as well as the communication mode we would pursue. After looking at all of this, we provide speech and language therapy services such as auditory training, listening checks, speech reading, and more that would progress their betterment. In doing so, we should always inform the families and caregivers about this and what they could do to help. Next, as always, we should observe and measure communication parameters using instrumentation-informed and clinically proven practices to evaluate and establish appropriate communication devices for our clients. By adhering to all of this, we can ensure the creation of an optimal healthcare plan and services for the HI population.
What we must always remember is that speech and language pathologists do not diagnose hearing impairments. What we diagnose are the communication, speech, or language conditions that are present alongside the hearing impairment of the patient.
What do we do when we meet a hearing impaired client? When we meet patients that are suspected or already presented with hearing impairment, the first thing to do is to ask or identify if the patient already consulted with an audiologist and already underwent an auditory assessment.
For our first scenario, if the patient arrives at your clinic without an audiogram, the next ideal step that you should do is to take the patient's case history. Remember that this is the first step of an assessment. The case history will tell you necessary information to strategize the type of assessment the patient needs. After getting the information, the patient will then undergo evaluation to be administered by the speech and language pathologist. This evaluation will produce a differential diagnosis. So you might wonder, what is a differential diagnosis? Differential diagnosis is when a medical practitioner differentiates between two or more conditions that could be behind a person's symptoms. If this diagnosis shows that the patient indeed needs an audiologist consult, refer to a licensed audiologist immediately. What if the patient arrives at your clinic and provides an audiogram? The first thing that you should do is to take the patient's case history. From here, there are two things that could be done. The first one is to evaluate the patient, and the second one is to counsel the patient with regards to his audiogram result. Sometimes, after evaluation, the SLP may conduct counseling to the patient with regards to his audiogram result. Now, if the SLP successfully evaluated the patient, the next step is to create a treatment plan to habilitate the impairment caused by the hearing impairment. For our last scenario, what if the patient arrives at your clinic and provides an aided audiogram? Let's first identify what aided audiogram is. Aided audiogram is when an audiometry is administered to test the certain threshold of the patient's existing hearing assistive device, such as hearing aids or cochlear implants. You will just basically repeat the process from scenario 2, and it will also end up in auditory habilitation, where the SLP will apply intervention to help the patient with the reason he came for us in the first place. The main takeaway from all of this is that we do not diagnose conditions that are not related to language, speech, swallowing, and communication. If the patient is in need of an audiogram, do refer the patient to a trusted audiologist. In conclusion, to successfully habilitate a patient who wants to keep or improve his skills, collaboration is what makes the motivation move. Without the specialized knowledge of each professional involved in the team, the intervention plan prepared by each one of them wouldn't work well collectively. We must remember that even if our scope and practice and our involvement with the patient is limited, we must always provide the best quality of care to each and every patient we handle, regardless of their impairment.
And that concludes our presentation. Thank you for taking time to view it. We hope that this would help you understand the roles and responsibilities of the habilitation team, especially that of SLPs, your chosen profession. It is highly important that you know the people you will be working with and the extent of what you can and cannot offer to your clients. As you near the end of your sophomore year and get closer to your journey as a junior in college, we hope you absorb all the learnings you ought to need and continuously grow as a student, as a person, and as an established speech and language pathologist in the future. Best of luck and goodbye. Thank you.